People wake up on a normal day and suddenly something happens that changes their lives completely.
Paediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and he's got an arterial bleed from his leg.
High-speed RTC moped into wall.
Jesus Christ, what happened? You all right?
I love my wife.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
I think it's going to be one of those days.
A place where life,
Darling, what's for dinner?
love,
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Gallop for me, horse, gallop for me. Gallop for me, for the bag of money, yeah.
Quite how long the wait is, babe.
Babe, if I run our share, they'll probably say 3 hour wait, yeah? And then you'll be like, oh, I'm going home.
Looking after her will be Bernie. Who is that?
Ape, hippo, gorilla. Yeah.
It's the weekend. At St George's, the next 24 hours will see 359 patients coming through the doors of A&E.
I'm in charge of everywhere.
Overseeing the care is team leader Daryl.
Yeah, just in that cubicle there, 12B.
Tooting's a strange place. I've always lived around this area. We've got very affluent areas and inner city, poorer areas.
He's been stabbed and assaulted about half an hour, 45 minutes ago. He's got a single stab wound in the centre of his back.
You can't pick out class or you can't pick out age as a discriminator because you don't know that that 20-year-old is more sick than the 90-year-old. You just don't know until you talk to them.
Hello.
I just kind of fell into nursing. It was one of those things that I didn't really plan to ever do. It was not like I was 2 and I'm dressing up as a nurse. It's not the kind of thing boys do when they're younger.
Is there anything you can't eat? I don't know what we've got. I can go and have a look. It's usually like cheese or ham or fish or...
what's that, salmon, is it?
It's tuna, I think.
Tuna, yeah, I'll have a tuna.
Are you comfortable like that?
Yeah.
You sure?
The first week that I wore this uniform, I think I got 2 comments just walking to Marks and Spencer's about buttons. I'm just going to get my coffee. I don't need this. I really don't need this.
4.7. Is that all right for you?
No, it's getting a bit low.
Yeah.
Working in A&E, generally, you have to have a million different personalities and you have to come to work with the expectation that you won't be the same person when you walk through the doors and you put on your uniform.
Hello, St George's Emergency Department. Medical trauma. Okay. stab wound to the arm, but a significant stab wound to face.
The priority call is for a 21-year-old male. He's being rushed to St George's after being attacked outside a pub in Kingston with a broken bottle.
You don't get any information about where people have been stabbed directly. You'll get facial stabbing. You don't get logistics of whereabouts in their face, so you kind of just have to plan for all eventualities. A young person being stabbed, generally, you'll probably get a bit of back chat. They're going to come in with a bit of attitude. There also might be a dozen people that come with them.
Who's 21, walked into a pub this evening and was bottled on the face, left-hand side, and also got a small stab wound to the arm. We don't know if that was with the bottle or with a knife. There was a couple of splurts coming straight out, so hence you will need your glasses.
Can we just take your shoes off? And we're going to need to take your jeans off as
well.
well.
All right, guys, relax. You're going to scare me, so let me just do everything in my own time, okay? Is that all right?
Something on your arm.
First things you think about are whether they've got any airway problems. The main concerns are going to be sort of scarring, loss of vision if they've done something to their eye.
We need to take that down. It's bleeding inside the mouth, so laceration is probably going the way through there. Just a bit of cold in your head.
Someone could die from a facial stabbing. Your spinal cord runs right down the back of your neck, and your base of your skull and your brain, they're all there.
He's not gonna die? Can you fucking sort this out, please?
An hour ago, former boxer Paul was on a night out when his face and arm were slashed with a broken bottle.
Do you have any pain across the chest?
No, I'm alright.
Press there. Any pain there?
No, I'm good.
After assessing his injuries, the trauma team are trying to stop the bleeding from the cut on his face.
Access on the left.
Put that there so we can get to it quickly.
Deep breath in for me. And out.
Go spout.
So listen, you're going to have a sharp scratch in your arm. I'm just going to take some blood samples, all right?
Yeah, go on. Oh, fuck this. I'm getting a little bit scared now. A little bit sick as well.
Still monitoring you, all right?
Okay. Oh my God,
You're not going to do anything. You can tell it yourself.
Paul is very good in situations that I'm not so good in. The violent things or things where he knows that something wrong is being done or something wrong's happening.
Am I right in saying you were bottled to the face? And
okay, no, what happened was the guy smashed the bottle, stabbed me in the face, and I think what happened was he stabbed me in the arm. I mean, I can't be completely sure.
With his boxing that he used to do, he's picked up a lot of injuries.
I'm going to give you some penicillin because you've been stabbed by a dirty bottle.
He wasn't boxing when I met him, and he didn't actually tell me that he was. I saw all the newspaper clippings on the wall, and I asked, oh, were you a boxer? And he said, yeah, I used to do it professionally. So I was like, oh my God, he fights. Shit, it's the one thing I hate. I think it was a good way for him to get his anger out.
This is the second time I've been stabbed now.
Really?
Yeah, take a look.
Not in the same pub.
He's got an underlying anger. Sometimes he doesn't even realise that he's snapping, but he always apologises.
Please don't be angry. I called your mum. Look at me. Look at me. Hello. Paul.
Yeah?
She's just happy
Happy what?
that you're okay. I just said that some guys were sitting on the wall, said something to you, so you said something back and they reacted the wrong way. I said, hello.
Yeah, I'm listening. It's fine. I'm just picking off the blood.
Can you hold my hand?
Yeah.
I said you didn't do anything wrong.
Oi, relax. Don't cry, please. Oi. Come on, you're gonna make me get pissed off. You're gonna make me upset, please.
Oh, take this one.
Leave it. I love you. I love you. You gonna give me a kiss?
It's a brother's kiss. Come on.
I love you. Why the fuck did you stab me in the face?
Excuse me? Excuse me, just me.
Yes.
Oh, sorry to wake you up. My name is Jacob. I'm one of the doctors. Can I, sorry, can I ask you some questions?
Yes.
Just Me has come to A&E with a sore foot.
So can you tell me what happened?
Yeah, basically I was going through Leicester Square in London.
Yep.
And somebody kicked my right foot from underneath me. I've got a swollen ankle. The foot is going into spasm, being cold, because basically I am, well, living on the streets. It's a long story, and...
So you say you live on the streets?
Yes.
Okay. Okay, I understand. Okay, I can examine your foot now, if you don't mind. What about this?
That's not hurting.
Is it painful if I press here?
I can't be in pain when I'm lying comfortably on this bed.
What kind of size? Paul?
Former boxer Paul's condition has been stabilised by the trauma team.
Can you do this for me?
His facial laceration is being treated by a specialist nurse, Nidal.
Do this. Okay, sensation in your left side, is it the same like the right side?
I mean, other than obviously my face being a little bit tight when I tense my jaw, other than that, it's cool.
Have you seen it already?
No.
Because they're probably going to take it all down.
That's
so
fine.
if you're happy.
I've got to go home with him.
You don't want to see this. It's across the whole face.
It's all right.
You sure?
Working in A&E can't do anything but change your outlook in life. You could live your life in fear of always thinking, oh, you know, what's going to happen today? Could I get hit by a bus? Or you just sort of blindly carry on and do the things that you love because that's what makes you human.
Just put your head back.
Love, do you want to be in here?
Yeah, I'm fine.
Can you get out, please? Please.
All right, I'm going.
All right.
Sorry, mate. Okay, I'll give you an injection now.
Oh, fuck this, man.
Come on.
Ah!
This stuff is definitely your friend.
Yeah,
it might not feel like it at the
know.
moment. It will when they start doing the stitches.
Yeah, it's starting to numb a little bit, but
good.
I mean, just for 1 second,
Yeah,
please.
yeah, don't worry.
Just so I can
No
catch
rush
my
at
breath.
all.
Is that okay?
Yeah, of course it is.
No rush. Okay, just head back and look that side for me.
First time that I ever worked in A&E at my old hospital, it was a case where a young guy who was the same age as me was out in the town where I lived, and he'd been beaten up by 3 guys just because he had asked for his girlfriend's hat back. And he died. And I think that was probably the first time that I'd really been affected by sort of a trauma-related injury, because he was identical age, and it was probably, you know, like 200 yards from where I lived at the time. And I think it took me a long time to kind of get over what it was that I was doing, and did I really want to carry on seeing these kind of injuries when it could be me at any point. But you just kind of get over it and carry on.
Sure?
Yeah, sharp. Fuck me, does it go the whole way back there? What the Do you know what?
Sorry.
Face, neck stabbings, you never know how it's going to be. The long-standing effects that you'll have afterwards with scarring might not cause you any real medical problems, but it will be there for the rest of your life, and you'll always know that that was the time that you got stabbed.
no eat or drink from now, okay?
Yeah, no problem.
Because
no,
we
I
need,
completely understand.
to make you ready for
Yeah,
operation
no,
by
it's
the
fine,
morning.
That's fine. It's fine.
Why am I missing all the food? It's like they just put it up there when I'm not here.
You've done nights with her.
One night.
Did she not make cake?
I didn't see any. Did she not communicate?
She's going to get failed.
Maybe she doesn't like me. Or maybe she never made the cake.
I love cake.
Cake is good.
You not talk about cakes, I'm on a diet.
I didn't see that there were very many people waiting out.
No, that's okay. But in any case, we can't keep the cubicles occupied, so sorry about that.
Just do with time to drink my coffee and then go.
Yeah.
It would be nicer if there was a place where elderly and the infirm could go, where there was nice beds and there wasn't patients to get through the department. But the reality is there's never going to be somewhere like that.
Where's that doctor? Where is he? Where's that doctor that looks after me? Thank you very much, Dr. Jacobi. Grazie prego.
Oh,
grazie prego.
Prego. Grazie.
Prego, grazie prego. Dr. Jacobi, grazie prego.
So, little Ma, what's happened is we're in St George's and you've come to just be looked at because you've got a couple of problems.
93-year-old Angela has been experiencing some blood loss and disorientation for several days. She's been brought from her care home in Wimbledon by her daughter Elizabeth.
She's normally fairly sparky and just a bit confused and weak now. Very not herself.
Right. How are you feeling? Good. Do you have any pain anywhere?
No.
Can I ask you some very silly questions?
Yes.
Who's the head of the royal family right now? Who's the monarch?
Queen.
Good. Can you count backwards from 20 for me?
19, 18, 17, 6, 16, 15, 14, 13.
Good. Who's that?
My daughter.
You think as you get older, you leave home and whatever, but it seems that she's part of our lives more than ever now. Really is.
That's good. Fine. No more silly questions.
I'm all right.
One thing we can say about Angela is you don't complain, do you? Never complain.
Well, it's not worth complaining.
No, it's not worth complaining.
It really isn't.
We were all born very close together, 3 daughters. Really lovely mum. We used to sort of fight over sitting on her lap, and you might find her sitting at the breakfast table with all 3 children sort of hanging from her, just wanting to sort of be around her. Bless you, Ma. I feel you should grin and bear it. Bless you. Are you comfy then? Let me just see if I can put your... There we are. My back. There we are. Now, how comfy are you? Not very. You walk in the room and her face is just a picture of lovely, it's a mixture of surprise and delight. And it kind of think, oh, good.
Referred to the gynecologist.
Yes.
We're trying to get hold of them again.
Yes.
A little bit, so they're going to come in now and see.
So what do you... What do you think?
Right?
Thank you so much. When I went to fetch her that morning, she did look very unwell. She was lying on her bed and she looked a strange colour and had a kind of gaunt look about her. And I thought, I was really quite concerned. With somebody 93, you know everything. You have to expect a difficult outcome because of the age.
In here, we are now under control. So 1 has just gone to the ward, 2 is going to the ward, 3 is not well, bless him. Where am I going to put anyone?
This morning, 70-year-old John was in a 5-kilometre race on Wimbledon Common when he slipped and hurt his shoulder.
Okay, I'm taking off his shoe. Did he fall into a puddle of water?
No, it's just very wet up there, and he'd already done 3 miles.
Blimey, why is
Okay, darling.
pain so horrible?
Well, it just is, John. That's what pain is. It's pain.
What have I done to deserve
Nothing,
this?
sweetie. We went running again. When I met him, he used to rally a little mini. I said to him, well, he's a really nice guy. Yeah, he's just such a nice chap. Oh, sorry. But John was going out with somebody, which I didn't know. And not only was he going out with her, but she was his navigator. So I suspect he might have asked me out before he told her.
So, you've dislocated your shoulder.
Okay.
There's also a little chip off the bone at the top, so you've not broken the main bit of your...
lovely.
The important thing is to get it back in position. You'll be a lot more comfortable.
That's going to really hurt, isn't it?
We're going to give you some drugs to make you very sleepy,
Oh,
okay?
lovely. Yes, please, put me to sleep.
Remind me, you're fit and well normally?
Yes.
I am a very fit man. I did London Marathon in 4:22.
Yeah.
He loves speed. Just before we're going on holiday, he'd go for a spin on the motorbike. You know, an hour's gone and he hasn't come back. And you think, well, what's happened? You know, surely he'd come back by now. You'd get a bit worried. He, I think, enjoys a bit of danger.
Give you some painkillers into the drip. It'll make you feel a little bit funny. Don't worry about it. Just see how you get on.
Can we done?
Okay. Yeah. It's in.
Yes, done. She'll start working. The magic.
Where am I? There's a big balloon coming. The sun has got his hat on.
This is what this drug does.
All those years, pile the years up. Oh, bloody blimey. Darling.
Yes, I'm coming.
What's for dinner?
Darling, sweetheart, I'm here. I'm here, darling.
Do I look different?
No, John, you look really well, sweetie. You look
Everything's
fine.
gone wobbly bobbly.
No, I know. Yes, everything. Oh, that's okay. I think you're a bit back again. Are you all right now?
No, I'm not. I'm in agony, darling. I'm in agony, agony, auntie. Why don't they... Why?
John, you've had some painkillers, sweetheart.
These beautiful people...
Ketamine is a slightly strange drug.
Yes, I think I'm going to keep off it.
John.
Yes?
Open your eyes.
Hello?
Open your eyes. Hello.
Hello, darling. Oh, blimey,
darling.
I feel a bit wobbly bobbly.
Bubbly, bubbly.
I like your hair. Oh, that's nice. Who is the greatest ever racing driver?
I don't know. Enlighten
Well,
me.
go and bloody find out, man. What's the matter with you? Coming in here.
Stop it.
Oh.
Ayrton Senna.
Oh.
Ayrton Senna, John, is what
Who said that?
Jenna said that.
Perfect. You're an angel.
I know.
Oh, it still hurts.
Oh, darling.
I turned the lights off to make him calm, because you look like you were closing your eyes. If we just turn the lights off and we make no noise, you might just settle.
Of Sauvignon Blanc, some olives,
Oh, okay.
and
Nice bit
a
of classical
beautiful
music.
film
Bit
in
classical
my
music.
armchair.
What about me?
Patet, my lovely wife.
Paul has had temporary stitches put into his face and needs follow-up surgery tomorrow.
Going about yourself?
Just giving him a wipe down.
Before going to a ward, he's being interviewed by police investigating the attack.
What's the idea going to want to speak to you? No, of course. See, if your wishes still remain that you don't want to proceed with any further benefit, and then we'll respect your wishes absolutely. Cut from there to there, that bastard's getting charged. Yeah. Oh, I'm glad that you're changing your mind. Because I didn't know. At first I thought it was only like that, but I mean, from there to there, that is taking a fucking piss.
Can I interrupt for 1 second? Yeah. Your dad, I think it's probably your mum ringing.
All right, cheers to that, guys. I appreciate it, okay?
I'll hold it.
That's fine, I got it. Hello? Don't cry. Are you alright?
You're worried about our baby.
What's up?
When people first meet him, he's not a very open person. You get to know him a bit, and he's so kind, and like if I was ill, he'd take days off work just to make sure I had enough Lemsip by my bed and things. And he's always tried to make a good impression on my parents. He's always very protective, nothing ever goes wrong. My mum's always like, stay safe when you go out, don't drink too much, and Paul always replies, yeah, we're fine, I'll look after her.
She just wants to make sure you're all right. And she loves you, okay? I love her too. That's all. She's just being a mummy, okay? You don't need to be sad because you're okay. Mummy was just... Stop crying, baby.
Obviously, everyone around him that loves him has now found out, and everybody's saying, we're here for you, we love you. He's just overwhelmed, definitely overwhelmed him.
I'm not crying. Hold it, baby, don't, because you made me I don't want to fucking pull your wires out and kill you. Stop, baby. Which one does it go on? Do it for me, because I don't want anything to happen. Which one does it go on? Okay? Hey. You're still as beautiful as ever, I promise. Don't cry.
I'm crying because you're crying.
I'm okay. Do you see tears rolling? I held them. You let them roll.
Some people need more looking after than others, definitely. You just need someone to sit and say, it's okay, everything's fine, and don't worry about it.
Stop it, it's going to take even longer.
Morning, Elvis.
Morning.
I always think of A&E nursing as like primary school teaching, because you have to know a little bit about everything.
You're supposed to be able to hear it. Yeah, no, I can't hear anything.
I can't imagine working in the emergency department and not having anything else. You know, not having someone at home and then not having a hobby. I'm in a band, and it is a great stress release. We just get together and we scream quite a lot because it's a grunge band. So one of them's an electrician, one of them's a painter and decorator, and they don't have any real inkling what it is like doing the job that I do.
Hello, Mr. Carter.
Oh, blimey, you've been numbering me.
No, you're all right. How have you managed this, then?
I was running this morning when I tripped with my right foot.
Yep.
And went flying through the bleeding air.
Due to the severity of the injury, a specialist orthopaedic doctor has been called to resus to treat John.
Your shoulder is a ball and a socket.
Yes.
Yep. So you jump the shoulder out the front of the socket, and I think it's hooked on the edge of the socket. And there's a bit of bone that's come off as well. We've got to be quite careful when we pull it in that we don't make the break around your shoulder worse.
I didn't start running until I was 64, 6 years ago, and I love it.
We were very young when we met. We enjoy a lot of the same things, and of course we can enjoy running together or on our own. I mean, I wouldn't run a marathon if you paid me.
You have to very, very slowly.
We're always doing a bit of exercise. We want to be fit, and we want to be healthy. I suppose there's an element of vanity included in that. You want to look good.
Can you make me 25 again?
Running means you can actually do what the hell you like. Cheese, love cheese. But we would only have cheese at the weekend. Then we start running, and we do eat cheese during the week now. And John has flapjacks as well.
Disimpact it a little bit. Might be all right. Coracoids there. We might be there. Yeah, but he's got a big hemarthrosis because of the fracture, so it's quite difficult to tell. So let's whip him around for a quick X-ray. We won't celebrate yet.
Oh, brilliant. I feel great now. Hey, rock and roll. Was that a double axle?
Okay then, Ma?
93-year-old Angela is having tests to find out the cause of her disorientation and blood loss.
Yeah? Who's you?
It's me. Oh, how easily you forget.
Yes, bless you.
We're waiting for a consultant to come and see you. And then they'll make a decision of what needs to be done next, OK? So I'm afraid you just have to be patient and sit it out. That's one of the realities of hospital life, really. She grew up, you do not talk about yourself. It's bad manners and people don't want to hear. Tell me about you. You've got a bit of an off-the-shoulder number here, Ma. We can't have that. She ended up working as an advisor at the Citizens Advice Bureau. She was very discreet, very understanding, with a natural empathy and a real love of people. Those things sort of created somebody who was just a very good listener. Are you worried that I'm wasting time? I thought you were going to say, I'm not wasting time at all. I'm perfectly happy with you here. You know you're in St. George's, and you're in a sort of ward where all sorts of different cases are coming and going. And it's absolutely fascinating. Can you see? Can you sort of people watch from here? And there are nurses coming past, and there are paramedics and trolleys and all sorts of things. We're in the hub of the hospital. It's like being a bit like at Wetherspoons and we watch the world go by, but the difference is we don't get a glass of wine here or a pint of beer.
So what is it then? What am I making?
See, lemon drizzle would be nice.
Lemon drizzle.
Okay, lemon drizzle. All right then.
It's refreshing, it's summery.
Yeah. All right, lemon drizzle. All right, Tuesday, lemon drizzle.
Check. It's an oxygen mask, I think. Is it, Tracy? Is that an
Yes, that's an oxygen mask.
Okay.
John's X-rays show that his shoulder is back in place.
Carbon dioxide
No, I
monitoring.
just wondered what it was, so
Yeah.
I'm not bothered about it.
Yeah, that's
are you
just
all right?
carbon
I think
dioxide.
so.
Last time when I'd been in a hospital, my mother died, and we were with her when she died in intensive care. Just to try and relax, sweetheart. I know it's difficult. My mum and dad's house was full of both of them. We had to go through all of that.
I'm going to try and move it now.
OK, yes, you're moving it all right, darling. You're moving it towards you. John was unbelievable. It's not an easy thing to do. It was just somebody who could help me with the sadness of needing to do it. And it's not something that you understand until you've done it, because it's a lifetime. And he was great.
John,
Now it's back in. Can you feel me touching you there? You feel that?
No.
You can't feel that?
No.
At all?
No.
Can you feel that there?
I feel that, yeah.
Can't feel that?
No. Let my hand is numb. She's there.
That feels completely numb?
Yeah.
Okay. Hiya. He's got complete numbness over his axillary nerve, and his radial nerve and ulnar nerve are not working. Yeah. Okay, no problems. Hi, I'll speak to you both actually. So I'm a bit worried that some of your nerves aren't working properly.
Do you think I've damaged the nerve?
You might have.
It's one of the things that does happen. We'll bring you in and we'll order an MRI to look at the nerves here. Okay?
What are you saying?
Okay.
You're all right. You're all right, darling.
Oh, hi Simon, I just wanted to let you know, yeah, I'm obviously in hospital. I have broken my femur.
He spends most of his time legless anyway, Margaret.
Was it Laurel and Hardy, Ma? What's Laurel and Hardy? Another fine mess you've got me into, is that right? Mm. And then another comedian who was ever so clever, and he was known as Old Stoneface, and he was your favourite. He did the film The General. Buster? Yeah. Exactly.
Doctors are concerned that Angela's blood loss could have a serious underlying cause. A specialist has been called to assess her.
She is in a care home, right?
Yes.
Yeah. And
Yes.
how long since they've noticed the bleeding?
Only the last 3 or 4 days. So we're hoping that you might be able to diagnose, and then we know where to go from there. I'll be back when they've finished, okay?
Whichever you
Whichever. I think I prefer that. And I think you need some privacy and dignity.
When you get to 93, it's not easy looking after yourself and dealing with the physicality of being in a big house. We had a conflab, and she said she'd like to try a home. And we said, okay, go in for a respite and try it out. And after the respite, I think it's 4 weeks, she said, I'd like to try a bit more. And with that, she never wanted to come back here.
You're so calm. I so admire you.
She was amazingly stoic, and she just said, this is my situation now. I don't want to go home on a Sunday and just sort of see what I've left behind. I've moved on.
With no obvious cause for Angela's condition, she's being allowed home and will return to an outpatient's clinic for further tests.
I'm just going to take the needle out.
Oh, there's a needle there.
Yeah, there. Because you're going home, aren't you?
Am I?
Yes.
It was terribly traumatic, wondering if we were doing the right thing. That one way, you know, that we would never see her in a bedroom again. We'd never see her in loving sitting in the kitchen, watching the world go by.
Ma? What's the most important thing we need to do to freshen us up? There are 2 things. One is this, Ma, I'll give you a little spray just to make yourself feel a bit better. And then, of course, the all-important, this one, I think. Here you are. Go on. Yeah? Wonderful. And then give your... talk about teaching your granny trick. Do you rub your lips together? You've had the most exhausting day, Mark. You've been examined, you've been pushed and pulled, you've had wires in your arm. You know, you've done bloody brilliantly. So you just zizz away and think beautiful thoughts.
Don't worry, sweetheart.
The orthopaedic team have found some nerve damage in John's hand and arm. He's being admitted for further tests.
Well, we're old gits, and we probably... What you were doing, you should have run with me.
Yeah.
Ah. You should have been coming with the slow road.
All these landmarks, 30, 40, 50, 60, 70, you know, every time you get to one, you think, well, that's not too bad, is it? You know, I'm not 90, I'm only 70.
So he's going to be admitted in grey ward.
Right.
So I'm going to get the notes ready.
It's rather ideal for the older person, isn't it?
This is a very young person.
There is an inherent quest to see if you can do something, and if you can do it, to see how good you are at it.
He's fitter than the 30-year-olds.
I'm adventurous in that respect. So I'm a Boy Scout, a 70-year-old Boy Scout, really. It's never left me. So...
Yeah, you ran a little bonnet.
I did actually get told by quite a few people, you know, this is really going to affect you. And I just kind of took it on the chin. I said, right, I'll just prove you wrong. And that's exactly what I've done.
I love you too.
I have actually asked her dad for a hand in marriage. Yeah. Unfortunately, he said no because he thinks we're a bit too young. But he said, you know what, you're perfect for each other. In a few years' time, yes. Right now, too early. And in that sense, I agree and I respect him for that.
Mummy, I don't know what to do.
It was about 9 o'clock in the evening. She was in bed, she was all ready, and she'd turned down a cup of tea or something, and she appeared to be sleeping, and then the nurse noticed that she wasn't. We feel so blessed that she died the way she wanted to, and I'm told it doesn't often happen like that. Being grateful, being thankful. She always says, I'm very, very lucky. But she's going to be missed, big time, yeah.